Good day, everyone. Thank you for being here. Today, we're going to talk about something that doesn't always get the attention it deserves: mental health during pregnancy. But before that, here are the speakers for our talks today. Pregnancy is a beautiful journey, but it can also be emotionally challenging. It's normal to feel anxious, overwhelmed, or even low at times. But when these feelings persist, they can affect both mum and baby. The good news is, help is available, and no one has to go through it alone. In the next few minutes, we'll explore why mental health matters, how to recognize the signs, and where to find support. Let's get started.
Hello everyone. We will begin the presentation with introductions and mental health overview during pregnancy. When we talk about mental health, we need to generally understand it as an important aspect of overall well-being, influencing how we think, we feel, and how we will act on something. So, what about maternal mental health? Just the same as the general mental health that we know, but this is more focused on the mother's overall emotional, social, and mental well-being both during pregnancy and after giving birth, usually up until 1 year of postpartum. Common maternal mental health problems and issues occurring are depression, anxiety, PTSD, which is standing for post-traumatic stress disorder, bipolar disorder, emotional stress, and lastly, psychosocial concerns. Mental health matters for everyone, not only for women or pregnant women, but here we want to focus on pregnant women because the mothers will experience significant emotional and psychological changes during pregnancy, and this will contribute to their mental health state, which will affect their physical health and giving long-term consequences if being left untreated. Also will affect their labor and delivery outcomes such as premature delivery or complications during the delivery, and last but not least, also contribute to their prenatal care adherence. So, these are the common emotional shifts experienced by the pregnant mothers. It is normal for them to have mood swings, being extra sensitive, easily get irritated by small things, having sleep disturbances, and worry about the baby or about giving birth. But you need to be more concerned and extra alert when the mothers are having persistent sadness or anxiety, loss of interest in usual activities, difficulty functioning, and also having intrusive thoughts. Have you ever wondered how common are mental health conditions among pregnant women around the world? So here we have the global prevalence and the data for it. The data stated that 10 to 20% of pregnant women are having mental health issues. 15 to 20% of them are having anxiety during pregnancy, and 1 in 7 women are having postpartum depressions. And all of this number are higher in low-income, minority, and marginalized populations. And we need to also note that many cases still remain undiagnosed and untreated. Maybe because of the mothers did not go for a checkup despite having symptoms, or maybe they did not realize that they are having the mental health issue. And lastly, we will talk about how the mother's mental health conditions will affect the mothers, the baby, and also the family. As for the mothers, it will affect the mother's physical health as their health will decline, reducing the mother's ability to care for herself and do their daily task. The next one is impaired bonding, difficult for the mother to feel connected to her baby. The next one is isolation. The mother will usually withdraw from the social support, which can worsen the symptoms and delay the recovery. And lastly, risk of self-harm and suicide. This is the scary one because in severe cases, especially with a postpartum psychosis, they may be at risk of self-harm or harming the baby also. Soothing the baby may become overwhelming for the mothers too. The next one is how it will affect the baby. The first one is delayed development. It will show delays in terms of emotional, social, or cognitive development. Feeding and sleeping issues. Infants may struggle due to disrupted bonding or inconsistent care from the mothers. Third one is insecure attachment, which can interfere with forming a secure attachment, which is critical for the child's emotional regulations and resilience. Next one is behavioral problems. It increases risk of behavioral issues, especially irritability and emotional control. It is hard for the baby to control their own emotions. And lastly, complications during pregnancy. If the mother have high stress or are mentally unstable, it will lead to a premature birth or low birth weight. Lastly, for the family, how the mother's mental health will affect the family. First one is strained the relationship. The partners may feel confused, helpless, or resentful, leading to conflict usually. The next one is the partner's mental health. The partner's mental health. The stress of supporting the struggling mother, resulting in secondary depressions or anxiety. The next one is the sibling impact. Other children might feel neglected or confused, which can affect their emotional well-being. And lastly is the economic strain, especially for those who are on the low socio-economic income, who has low socio-economic incomes. They will reduce the work capacity on it, and or need for professional care and support services can put financial pressure on the family. And that's all for me. Thank you. Moving on to the next speakers.
Hello everyone, and thank you for being here today. My name is Nimi, and I'm here to share with you some kind of important informations about the mental health during the pregnancy. Sometimes that is not just important as your physical health. Pregnancy can bring you some kind of mix of joy, excitement, and also stress or worry. Many mothers and their partners may not realize that changes in mood and also emotions during this time could be a sign of a deeper mental health concern. Today, we'll go through some of the common mental health issues experienced during pregnancy, their symptoms, causes, and why it's so important to get help. Let's begin. Let's start talking about the antenatal depressions, which means depressions during the pregnancy. While it's completely normal to feel emotional or tired at times, some women experience strong, ongoing feeling of sadness, irritability, and also hopelessness. Symptoms may include like they always feeling sad or tearful most of the time. They also lost interest in people or things around them, becoming easily irritated and also easily angry. Changes in appetite, either they will eat more or less than usual. They also have negative thoughts like worrying they won't be a good mother to their child in the future. If these symptoms continue for more than 2 weeks, it's important to seek help immediately. Without support, this condition may continue even after birth and become postnatal depressions. So, why does this matter? Because untreated antenatal depression can affect not just the mother health but also the baby development, family bonding, and the entire pregnancy experience. The good news is help is available and recovery is possible with the right support. Now, let's talk about the anxiety disorder during your pregnancy. It's normal to have some worries while you're expecting. But when the worry becomes more intense, constant, and start to interfere with your daily life, it may be more than just regular pregnancy stress. It could be an anxiety disorder as well. What are the causes of it? It's because of the hormonal changes during your pregnancy. It's also due to your past experience like the miscarriage or pregnancy loss before you become pregnant again, and also because of your poor sleep and worrying a lot of your partner, baby, or even future. What are the symptoms should you look out for? The symptoms are include constant uncontrollable worrying, panic attacks like you can't breathe, chest pain, or even sudden fear, difficulty focusing and also falling asleep, feeling very restless or in age, and also raising in your heartbeat. If left untreated, anxiety during pregnancy can affect the baby too. It increases the risk of preterm birth. Baby are more likely to born too early, and also they can experience low birth weight, smaller in head size, which can affect the brain development of the baby. Remember, it's okay to feel overwhelmed, but please don't suffer in silence. Anxiety is treatable, and getting help can protect both of you and your baby's health. Now, let's move on to talk about the post-traumatic stress disorder, or also known as PTSD. PTSD is a type of anxiety disorder that happens after experiencing something very stressful or frightening. For some, it may start soon after the event, while for others, it might take months or even years to appear. Did you know that around 1 to 2 in every 100 women may experience PTSD after their childbirth? What are the causes that can cause to PTSD during or after the pregnancy? It's because of the traumatic birth experience and pregnancy loss or stillbirth, and also due to the neonatal death. Neonatal death is when a baby passes away shortly after the birth. The common symptoms of the PTSD include flashback or nightmares about the event usually appears in their dreams, and also they usually have some kind of disturbing thoughts or mental images, experiencing physical symptoms like they're extremely sweaty and also they're raising in heartbeat. They also feel so grumpy, difficulty in sleeping, and avoid the reminders of the trauma. So, what happened if it's not addressed? It can lead to fear of future childbirth, and also some may struggle to bonding with their baby. PTSD is a serious, but it can be treated. You don't have to go through it alone. Reaching out for support early can make it a big difference for both the mother and also baby. Let's talk about the perinatal and postpartum depressions. This is a type of depressions that can happen after giving birth, but it can also begin anytime during your pregnancy. Unlike the short term, also known as the baby blues, which usually disappears within the 2 weeks, postpartum depression can last much longer and feel much more intense. The causes of the perinatal and postpartum depressions are a personal or family history of mental health conditions. They also might have lack of support from the emotionally, socially, and also financially. The stress of adjusting to a life as a new parent. The symptoms includes feeling sad or low most of the time. There will be more troubles to bond with your baby, difficulty in the concentrating, and also lost interest in things you once enjoyed. It also increases the anxiety and also panic attacks. If left untreated, the depression may get worse. You may develop a weaker emotional bond with your baby. your overall mental and emotional health may suffer. The good news is help is available. You don't need to wait for a diagnosis to speak up. Talk to a doctor, nurse, or even someone you trust. The earlier we support mental health, the better it for both mother and also baby. That's all for me. Thank you.
Assalamualaikum and hi everyone. I will continue the talk about something that's very real but often not talked about enough. It's about how partners and family support can affect a pregnant woman's mental health. You know, pregnancy isn't just about a baby bump or checkups. It's a roller coaster. Emotional, physical, mental, all happening at once. And no one should have to ride that roller coaster alone, right? During pregnancy, a woman goes through a whirlwind of emotions like joy, fear, anxiety, and excitement, which sometimes all in the same hour. And studies show that emotional well-being is just as important as the physical health for both the mother and the baby. So today, I'll share why support from the partners and the family is not just helpful, but it's also essential. So imagine a pregnant woman who's feeling overwhelmed and her partner simply says, "Don't worry, dear, we are in this together." That one sentence can ease so much emotional weight. In fact, research shows that women who feel supported by their partners are less likely to experience prenatal depression or anxiety. And on the other hand, lack of support can lead to stress, loneliness, or even complication during their pregnancy. What does support actually look like? It's not always about grand gestures. Sometimes it's as simple as asking, "How are you feeling today, honey?" Helping around with the chores without being asked, going with her to appointments or checkups, or even just sitting beside her when she needs quiet company. And here's a reminder, partners also need to check in on their own mental health because you can't pour from an empty cup, right? Now, let's zoom out a little because support doesn't stop at the partner. Parents, siblings, or even close friends play a big role too. Sometimes all a mom needs is someone who says, "It's okay, dear, I've been there too." Or a family member who drops off food, watches their older kids for an hour, or just listens. These little things create a strong emotional safety net. But let's be honest, not every woman gets that kind of support, right? And when support is missing, it can be heavy. The risk of depression rises, relationship gets strained, and even the baby's development get affected by the mother's stress levels. That's why this isn't just a bonus, it's a basic need for healthy pregnancy. So, what can we do? Honestly, it starts small. Just being aware that emotional support matters. It's already one step forward. We can encourage open conversations, check in on the mom around us, and remind partners and families that their support, love, and presence matter. And if someone's struggling, suggest taking a counselor. No shame in that. It's a strength actually. So that's all from me. Thank you for listening, everyone. I'll pass the talk to the next speaker.
So, hi, I will continue the sharing for today, which is about the management and also the coping strategy in mental health during pregnancy. So, sometimes life can be overwhelming to the some person in the world, and it is okay for us to feel that. But the most important thing is we should know when we have to seek help before it become more worsen. You should reach help from others as soon as you feel that the mental health is affecting your daily life, and it also play with your mind and make you feel some thought that you should never have. For example, this can look like a constant feeling of sadness or anxiety, And the next one is you have trouble when sleep and also when focusing on something at sometimes. And the last one is you feeling overwhelmed, hopeless, or also emotionally numb. If any of these symptoms sound familiar to you, please know that you are not alone and there is always help out there available to help you anywhere and anytime. We will move to next slide, which is how you can actually get help. First, you can talk to the doctor or also nurses. They can hear your stories and also refer you to the specialist if needed. Next, you can visit the local mental health unit. Many of these places have in-house counselor and also professional that train in helping people with mental health problems. If you feel like you cannot go out, you can also use the mental health hotline. These hotlines are available 24 hours a day and it offers anonymous and also immediate support to help you taking care of your mental health. So the last slide that I will share with you is besides seeking help, there are also healthy ways to cope with the mental health and also stress challenge. First is the relaxation technique, which is use deep breathing and also progressive muscle relaxation and mindfulness and also help calm your body and also your mind. Second, you can consider to join a support group, whether it is in your community or it is in online. So sharing with others about your story can help relieve some of the emotional burden in yourself and also it can make yourself become more healing. Third is to take care of your body. So you have to sleep well and also make sure don't forget to do some light exercises like yoga or walking. Just 30 minutes of exercises a day can boost your mood and make your mind more clear. And lastly, don't underestimate the power of therapy. So whether it is talk therapy or CBD, these approaches can help you and your emotion and also thought become more better. So that's all from me and
Okay,
thank you.
everyone, time for a little brain game to see how much you know about mental health during pregnancy. I'll read a statement. You decide, is it a myth or a fact? Ready? Let's go. Statement 1. All pregnant women feel happy and glowing. Statement 2. Mental health problems during pregnancy can affect the baby too. Statement 3. There's nothing you can do to manage mental stress during pregnancy. You can pause the video and answer it in the comments section below before we give you the answers. Okay, let's reveal the answers. Statement 1 is a myth in reality. Many women experience mood swings, anxiety, or even depression during pregnancy. Next, Statement 2 was a fact. High levels of stress or depression can affect fetal development and bonding. Lastly, Statement 3, which is another myth. With the right support, self-care, and medical help, it is manageable. So, in a nutshell, let's work together to create a supportive environment where mental health is a priority. Thank you all for your attention and time. Hope to see you guys again. We wish you all a beautiful and memorable journey during your pregnancy.